and it's good to be back and sharing some eye care tips with you. On the occasion of World Sight Day, I'd like to tell you something about protecting and taking care of our eyesight. I'm Dr. Mahesh Uparkar. I work in Prism Eye Institute, and today I'll be sharing some common knowledge about common eye disorders and how we can take care of ourselves. Who doesn't know the importance of vision? It's an important, not only a sensory organ, it's a window to our world. It's how we connect with others. And our vision is what makes us happy about the world around us. In fact, 80% of our memories are determined by what we see. For such an important organ, a World Sight Day, which usually falls on the second Thursday of October, has been celebrated for the last 20 years. It's an annual global event which tends to draw attention to blindness or any form of vision impairment, with the main objective being creating awareness about eye care, causes of blindness, its treatments, and the curing of eye impairments. This day focuses on drawing attention to the leading causes of blindness all around the world or visual impairment, such as cataract, glaucoma, or refractive errors. Given the enormity of eye disorders, it is no wonder that India, which has the largest population currently in the world, will have a lot of eye disorders. Globally, about 2.2 billion have some form of visual disorder. It could be a refractive error or any other minimal eye disorders. Among these 2 billion people, nearly 1 billion have vision impairment, which could have been avoided and yet be addressed. As per a recent survey, approximately 2% of India's population is practically blind. In India, nearly 1.1 million people are cornea blind in India, which means that India requires more than 1 lakh cornea transplants annually. But we have a current annual number of 25,000 only. To look at sight and vision, sight is the physical sensation of a sensory experience in which light reflects off objects and the eyes are able to focus on this light. This signal of a visual sensation is sent to the brain, and the brain is what interprets what are these images. Sight allows a person to witness an event or particularly enhances the vision and helps understand the significance and help draw interpretations. Protecting your eyes and your sight is highly important so that you can avoid harm to yourself. To understand sight, let us understand the anatomy and physiology of the eye. If you look at the eye, the anterior part of the eye is the clear part through which we see the cornea. Light follows or falls on this the central part of the opening called pupil through the clear crystalline lens, which is focused with the help of these ciliary muscles going front and back. The light is helped on its way back to focus on the back layer of the eye, the thin layer called as the retina. The retina is the neurosensory layer. The light falling on that is then directed towards the optic nerve and thence towards the brain. I'll be discussing about common eye problems. Both children and adults have different eye problems, but many of these problems are very similar and they are like refractive errors, like myopia, having a high hyperopia, astigmatism, dry eyes, or a digital eye strain in the current scenario, allergic eye disorders, night blindness, color blindness, cataract, glaucoma. I'll be gradually discussing over the period of this next 10 to 15 minutes about these common eye disorders. In children, the common eye problems that we see are either a lazy eye, which is medically known as amblyopia, where there is a certain amount of change in the refractive error in one of the eyes compared to the other eye. And because of this differential change, there could be less usage of one of the eyes, resulting in a lazy eye. This can further lead to squinting or cross eyes or strabismus in the medical terminology. There could also be some amount of drooping of some of the eyelids of one of the eyes, and that results in ptosis. In older people, the problems are different. Presbyopia or nearsightedness, which increases with age, cataracts, glaucoma, age related macular degeneration, and diabetic retinopathy. Let's come to the common eye problems. Myopia or nearsightedness is a condition where there is vision, but the vision is only good enough for near things. In these cases, the things which are near are clear, but the far objects look blurry, which is also in a different way stated that the eyeball is slightly longer in length than a normal eye. It is often hereditary in nature, and usually it is symptomatic in early childhood between ages of 8 to 12 when the child starts reading a lot. It could manifest in the form of squinting or headaches. And the most common form of treatment for myopia is in the form of spectacles or glasses, which are in the negative power. Contact lens can be given in certain scenarios. And after the age of 18 or 20 years, when the eye power stabilizes, surgery for myopia is also an option. Now, there are newer studies which show that the rate of progression of myopia can be reduced in certain children with the help of eye drops, and that is the newest way of treating this problem. Hyperopia or farsightedness, the complete opposite of myopia, where distant objects are seen clear but the near objects are blurred. And in turn, the eyeball is shorter than normal, and the image formed, therefore, is behind the retina. Usually, hyperopia manifests in older people with trouble reading words, words getting blurred, and a need to squint or strain our eyes, and often manifesting as headache after prolonged reading. The treatment, again like myopia, is in the form of spectacles or contact lenses. And over the age of 18 years, surgery is also an option for hyperopia. Amblyopia is a tricky one. It usually manifests in early childhood where the child's eyesight does not develop as it should in one of the eyes. This virtual ignorance of one of the eye is called as lazy eye. The vision is not normal, even though there is no obvious pathological condition associated to it. There are no obvious symptoms, which makes it difficult to identify and treat. Typically, lazy eye can be detected when the normal eye is covered, as in an eye test or at school vision screen. Early diagnosis is critical in children so that treatment is more effective, as it is important to have healthy binocular vision for many of the tasks in our day to day life. The treatment comes in the form of spectacles, which are given with a certain amount of patching of the good eye so as to train or work out the lazy eye and catch up with its development with the normal eye. Amblyopia can be diagnosed as early as 2 years of age, where the underdeveloped underlying problem can be corrected. It could be a cataract, a refractive error, or simply a squint. Astigmatism, as the name suggests, there is no stigmata or there is no point vision, astigmatism. And here is a condition where the cornea or the front part of the eye, which focuses the light, contributes a large part to the power of the eye, and it is not perfectly round or smooth in these people. This imperfection induces differing images and therefore astigmatism and results in visual blurring or distortion. Astigmatism can present in younger children and could develop even at older children during puberty. In children, astigmatism is a very common cause of lazy eye. The symptoms, it could manifest in the form of headaches, eye strain, squinting of eyes, or trying to squeeze eyes, distortion or blurring of vision, or in older people, difficulty in driving in certain scenarios, example at night. The treatment again for astigmatism would be early glasses, contact lenses in very low astigmatism, or in case of very high astigmatism, a refractive surgery could help. Strabismus. In children, this is a very common cause of cross eyes, is also called as strabismus or squint, and it commonly is a cause of a lot of stigma in the child as well, a growing child. This is caused because of a misalignment of eyes, where one eye looks straight ahead and the other eye looks upward, downward, left, or right, and it is not coordinated with each other. The causes, because there are six muscles around the eye and they don't function in coordination because of muscular dysfunction, because of any refractive error like farsightedness, because of any trauma, or purely genetic. These are the various reasons why a child could develop muscular dysfunction and squint. And the symptoms would be blurry vision, headaches, excessive turning of the eye, in some cases, excessive turning of the face and trying to see. In some cases, children may develop a lazy eye and suffer from poor vision. Squint has various forms of treatment. The most common form of treatment involves treatment of the refractive error under eyeglasses or sometimes eye exercises and sometimes eye muscle surgery to align the eyes to each other is very critical. Surgery is a common form of treatment, and it is a myth that surgical treatment does not result in good results. Nowadays, with a lot of alignment surgeries and adjustment surgeries, there are very good results, excellent results, which result in early binocular vision in the children. Droopy eyes, ptosis. Now, ptosis is the medical term for the drooping of one of the eyes compared to the other. The droop may be minor or may cover the eye slightly, or it could be blocking the visual field while covering the pupil, the center part of the eye. Often, due to hereditary properties, a child could be born with ptosis, and this may obstruct the natural development of the child's visual capability, resulting in a lazy eye or a squinting eye. Ptosis usually does not become better which is on its own over time. Children may need treatment such as surgery in order for the vision to develop properly. A doctor who is specialist in these kind of problems needs to be consulted so that both eyes look equal and there is proper visual development. Coming to the problems of older people, corneal ulcers are rare but are very dramatic and drastic complication of eyes. This a corneal ulcer is basically an open wound of the cornea where a thin front layer of the cornea is actually eroded due to infection or some other injury. Medically, this is called as keratitis, and this could manifest in the form of redness of the eyes with an open sore visible, as in this case, a white patch visible in the clear portion of the eye with pus, thick discharge, typically pain, a lot of pain on opening and closing the eyes, which is aggravated by bright lights, swollen eyelids, and a feeling that there is always something pricking inside the eye. Now, this kind of problem is usually caused by a bacteria entering the eye, or a virus, or a fungus, or some parasite infection. And the medication or the treatment is in the form of medication for that specific, looking for the specific organism. Depending on the cause, antibiotic, antiviral, antifungal eye drops are given. This might need to be used for nearly a week or more than that. Surgery is used as a resort for treatment if the medications do not work or if the ulcer is severe or has caused a complication, where the cornea needs to be replaced either partially or totally with another healthy one from a healthy donor. Conjunctivitis or pink eye is one of the most common eye complications world over. Pink eye is an inflammation or infection of the white portion or the transparent conjunctiva that lines our eyelids. The small blood vessels in the conjunctiva become red and become so engorged with blood that this causes the white of the eyes to disappear with the appearance of a reddish or pink eyes. Pink eye is commonly caused by a bacterial infection or a viral infection or an allergy. Though pink eye can be irritating, it rarely affects vision. Treatment usually can be in the form of antibiotic drops or some antiviral drops. Because pink eye can be contagious, early diagnosis and treatment is important so that the disease can be prevented from spreading. Symptoms, usually the pink eye is, as the name suggests, in the form of a red or pink eye with itchy eyes, something gritty sensation inside the eyes. A discharge is very common with a yellowish discharge around the nasal part of the eye and a lot of watering or tearing from the eyes. As I said earlier, it could be caused by a virus, bacteria, some allergies, or in fact a foreign body which has entered the eye. And prevention of this problem is the most important part where we will practice good eye hygiene. We don't touch our eyes with our hands. We wash our eyes and hands often. Use a clean towel, use it so that it is segregated from normal people and not to share the towels with any other person from the family. The treatment is aimed at symptomatic relief in the form of artificial tears, cleaning of eyes with a wet cloth, applying cold or warm compresses. Contact lenses wearers are to be, I would advise stop the wearing contact lenses. In most cases, antibiotic drops would not be required. In some cases, however, antiviral eye drops could be required. Coming to a very common problem and a very feared and dreaded problem of older group, cataracts. Cataracts, or as we call in India, motiabind, happens to be the most common form of treatable blindness world over. A cataract is basically a clouding of the central part of the eye or the clear lens. Seeing with cataracts is like seeing through a frosty or fogged up window. And typically, this will manifest in the form of a blurring or clouding of vision with halos around light, problems seeing at night through light and glare, fading of colors, and frequent changing of glasses is a very common thing. Sometimes double vision or diplopia could also be one of the manifestation of cataract. Now, what causes cataract? Other than age, there are various other reasons which include eye injury, surgery, blood pressure, obesity, alcohol consumption and associated malnutrition, any form of hormone therapy, especially involving steroids, high exposure to ultraviolet light, and as I said, poor nutrition and smoking. However, age related or age induced cataract is the most common form of cataract. So, what happens with cataract because of the blurring of vision? We would consider for a change of glasses when the early stage of cataract is manifest, or in the later stages, a surgery could be considered for cataract surgery. So, when would we consider a person fit enough for cataract surgery? When the blurring of dimness of vision is too severe and affects day to day life. Problem seeing at night for people who are active at night, maybe driving through the night, who have glare and problems of seeing light. Those who have fading of their colors, fading of vision, unable to see despite a change of glasses. These are the people who are eligible for cataract surgery. So the age-old aphorism that cataract is to be only done when there is a complete whiteness in the eye, okay, or motiabind pag gaya hai. So that is not followed nowadays because we have better and safer and very effective ways of treating cataract. So what's the modern way of doing cataract surgery? The modern way of doing cataract surgery is removal of the clouded lens and replacing this kind of clouded lens with a clear artificial lens. The artificial lens is called as an intraocular lens, is positioned in the same place as the natural lens and remains a permanent part of our eyes. In rare instances, some eye problems prohibit the use of an artificial lens, and in these situations, once the cataract is removed, vision may be corrected with eyeglasses or contact lenses. A very classical example is very young children who develop cataract, say at an early age in life. We usually do not insert intraocular lenses. Cataract surgery has become so very easy nowadays that it is done as an outpatient procedure or a daycare procedure, which means the hospital stay is usually for 3 to 4 hours. The eye doctor usually gives a local anesthetic around the eye to numb the eye, but the patient is completely awake of what his surroundings are and the procedure being done on the eye. Patient is usually aware of what is happening without any pain happening. Cataract surgery world over has become very safe due to the modern techniques, antibiotics, and modern procedures which have followed. So you'll have less and less discomfort. However, a 1 week's stay after cataract surgery and 1 week's rest after cataract surgery is generally recommended. But complete healing takes about 6 to 8 weeks. Coming to the next big cause of blindness in India and irreversible blindness is Kala Motia. Kala Motia, yeah, Marathi mein it is called as Kach Bindu, and in English it's called as glaucoma. Glaucoma is a condition which causes damage to the main nerve of the eye, the optic nerve, which actually relays images that have been taken by the retina and to the brain. And because this relay system or this cable system gets affected, what happens is we have a decrease in the peripheral vision of the eye, which closes down on us. Glaucoma usually happens due to buildup of high intraocular pressure. It occurs when the eye cannot drain excess normal fluid from the eye outside, and this damage builds up the pressure and damages the optic nerve and causes blindness, which is often irreversible. And because this happens slowly without any symptoms, without any pain, it is called as a silent thief of sight. So, what causes glaucoma and what are the risk factors in glaucoma? Risk factor for glaucoma again, age is the biggest risk factor. Anybody above age 60 is at a high risk of getting glaucoma. Anybody with a family history of glaucoma is at a high risk of getting glaucoma. People taking certain medications involving steroids are at high risk of glaucoma and cataracts. People with diabetes, heart disease, high blood pressure. Those with have extreme high power, example, those with high plus glasses are at higher risk of glaucoma. People who have undergone eye surgery or have had any eye trauma in childhood can also have glaucoma in later life. Taking of corticosteroid or steroid medication in any form, in the form of in maybe a puff for asthma, as a skin cream for allergy, or some sort of a steroid tablet for any other arthritic condition, are also at high risk for glaucoma. The biggest and the most important takeaway for glaucoma is that if a diagnosis is made in the early stages of glaucoma and treated appropriately, vision loss can be slowed or prevented. Treatment for glaucoma is for the whole life. How to make a diagnosis of glaucoma? So during a glaucoma exam, the eye doctor, the ophthalmologist will check a few certain parameters about the eye. The first and most basic would be checking the pressure or the eye pressure done with an instrument called as a tonometer. The examination is called as a tonometry. Inspecting of the drainage angle, gonioscopy. Examining the optic nerve for damage, either with the optical coherence tomography or with a clinical examination, and testing for the visual field or the side vision with an instrument called as a perimeter, and the examination is called perimetry. Measuring the thickness of the cornea, pachymetry, is another part of an important part of glaucoma measurement. So the most important treatment for glaucoma is in the form of eye drop, and glaucoma is treated using eye drops to lower eye pressure. The eye pressure can also be reduced by oral medications, by laser surgery, or by an actual surgery to cut down on some of the areas of blockage of glaucoma. So, as I said, the most common form of treatment for glaucoma is in the form of eye drop, which help reduce the eye pressure and they improve the fluid mechanism around the eye by decreasing the amount of fluid within the eye. Depending on how low the eye pressure is needed, number of drops can be increased or decreased. Surgery and other options. Laser therapy or laser treatment for glaucoma involves laser trabeculoplasty, where the drainage portion of glaucoma patients is opened up with the help of a tiny laser beam, which is painless procedure, to open up the clogged channels of the trabecular meshwork from which eye fluid flows. If the laser therapy does not work, drainage tubes can be implanted in the same area, which help in draining away this excess fluid and help in lowering of the eye pressure. When both tubes and laser surgery does not work, a filtering surgery with a surgical procedure, a small nick is given on the white portion of the eye and clearing an area of the eye called a sclera, which removes a portion of the trabecular meshwork. So this is a traditional way of treating surgery. And the newest way of treating glaucoma is minimally invasive glaucoma surgery. This requires less immediate post-operative care and has lesser risk as compared to an open surgery or a filtering surgery. Coming to other age-related disorders which causes blindness, age-related macular degeneration is one of the very common cause of central visual blindness. As you can understand, the name macular degeneration refers to a certain portion of the eye. Macula is the central portion of the back part of the eye, the retina, and this portion is which gives us the best vision. Macular degeneration, also known as ARMD, is a medical condition where loss of the central vision is seen. It is one of the common causes of blindness and people find hard to recognize faces, drive road, and perform other activities of daily life because there is a central black spot in the visual field. Typically happens in people who are 60 and above. And what are the risk factors for glaucoma, for this age-related macular degeneration? The risk factors for age-related macular degeneration are heredity, where it could be transmitted between the parents, from the parents to the children; smoking, which is a common risk factor for AMD, where nicotine within the smoke causes a change in the phenomena around the blood vessels of the back portion of the eye; obesity, high cholesterol. These are other common reasons why some people are prone or at risk to develop AMD. And there are two different types of macular degeneration. There is the dry type and the wet type. The dry type, the dry type is where the changes in the macula are actually without any new blood vessel formation, where in the healthy macula, waste products from the retinal metabolism accumulate in the back portion of the eye. Eventually, the dry type can result in the formation of new blood vessel where the waste products increase and there is new blood vessel formation. There is bleeding inside the eye, and that results in a very acute, traumatic central vision loss. If I look at AMD, how do I diagnose AMD? So, if anybody is suspected from suffering from age-related macular degeneration, then one of these two exams would be needed: optical coherence tomography, or OCT. It's a special kind of scanning of the eye which shows a magnified and 3D image of the back portion of the retina. And this helps identify any specific undulations in the retinal architecture, any swelling, or any thinning of the retina. The beauty of this particular scan is that if the swelling is getting better or worse, that can be monitored on a sequential basis, and therefore an OCT is a very vital tool to monitor age-related macular degeneration. Another common tool to identify AMD is fluorescein angiography, wherein a small fluorescein dye is injected into the forearm vein and sequential photographs are taken as the dye passes through a circulation into the eye, into the blood vessels of the retina. Where this dye, as it passes through a special filter, the filter allows that we can take blood vessels, pictures of the blood vessels that are leaking versus those that are non-leaking. And the small area in the center of the eye, in the retina, can be identified whether it is having any leakage of blood vessel, where the dye passes out through these areas. For dry AMD, the treatment is not very specific. It could be in the form of certain multivitamin tablets, which are very specific for elements which are found in the retina, lutein and zeaxanthin. For wet AMD, the treatment is in the form of intravitreal injections, which have been known to slow down and also, in early cases, reverse the disease process. Coming to diabetic retinopathy, as you know, diabetes affects many people in India, and in fact, India is going to be the diabetic capital of the world. So, awareness of diabetic retinopathy is very critical. Diabetes affects the eyes in various ways. It can cause damage to the blood vessels, the light sensitive area at the back of the eye, the retina, that gets affected because of diabetes. At first, diabetic retinopathy may cause no symptoms in the early years before 5 years of diabetes, or only mild visual symptoms. Eventually, as the duration of diabetes keeps on increasing, the risk of causing retinal problems, visual disorders keeps on increasing. Diabetic retinopathy can develop in anyone who has either type 1 or type 2 diabetes. And the longer you have diabetes and the less controlled is the sugar, the more likely we are to develop diabetic retinopathy. And what are the symptoms? Spots or black spots or dark spots in front of the eyes, floating objects in front of the eyes, blurring of vision, fluctuation of vision, poor color vision, dark or empty areas in the vision. These are one of the common manifestations of diabetic retinopathy. And what are the risk factors for diabetes affecting the retina? The most important risk factor being duration of diabetes. The second most important being Control of diabetes, poor control leading to worse manifestation. Along with diabetes, higher blood pressure, higher cholesterol, use of tobacco, having renal disorders, these all can affect and present in the form of diabetic eye disorders. So, what would be the treatment for diabetic retinopathy? The most critical element is towards managing your diabetes, and the treatment goal is geared towards slowing or stopping the progression. It involves a combination of multiple objectives. One is to control the blood sugar, control of blood pressure, control of cholesterol. Treatment is in the form of laser treatment and various other injections. In COVID times, we have been found to be involved in a lot of online programs, right from school age children, older people. And eye strain due to long hours of working on the computer is a very, very common disorder. The term eye strain is very generic. It describes a group of symptoms which occurs in some people after extended use of eyes. It is usually manifested in the form of very discomfort. It does not lead to any eye damage. In today's scenario, extended computer or screen use, like mobile phones, gaming, with poor lighting can cause eye strain. Eye strain is usually irritating, annoying, and usually not very serious. The moment you stop using the screen, the moment there is decreased screen time, eye strain vanishes, and that is a good part of this problem. But in some cases, the symptoms may persist despite not using the screen. And in this scenario, treatment may be required in the form of certain eye drops. For some people, I would recommend that in case you are not able to change your job or the nature of your work, then using protecting eyewear can also help reduce eye strain. Overall, the overexposure of ultraviolet rays can result in harm to the eyes and manifest in the form of blurred vision or double vision, eye irritation, stinging or burning of the eyes, watery eyes, redness, intense headache, feeling of disorientation, and difficulty in focusing. As I said, due to the COVID-19 lockdown situation, the use of digital devices has tremendously increased in previously known people who had never used a screen, like watching television, news, smartphone use, especially at night, as using it against the light, video on demand and OTT platform use, chatting, and social media. So here is a recipe for eye strain that I have recommended. And I would recommend that in all this recipe, you should not use any of these. If you have any difficulty in reading, shopping for groceries, cleaning and dusting, working on laptop, so this has impacted every aspect of our life. And I would recommend the following healthy eye tips for people to prevent them from eye strain. A golden 20-20 rule is well known, but practicing eye distancing from the screen nearly 40 centimeters or 25 inches, using the night mode or the safe mode, lowering the brightness of the screen is a very good way. As I said, 20-20 rule is very commonly known. That is, you can use the screen for 20 minutes while it is 20 feet away, and for 20 seconds, you have to just keep your eyes closed and then resume your work. Washing your eyes regularly is a very important way, and decrease the amount of nighttime use of screen. Consider turning off all overhead lights when working on desktop or laptop and try to blink more. A conscious effort at blinking will help with reducing eye strain. So, given that we have so many issues that can happen with our eyes, especially during this time, a need for a regular eye checkup is very critical. The eye checkup for people who are not aware involves evaluation of vision and checking for certain eye disease. Each test during an eye exam evaluates a different aspect of our vision and eye health. An eye exam helps detect eye problems at the earliest when they are most treatable. A regular eye checkup helps early detection of eye diseases and helps treat them better. So the different eye tests are visual acuity, where a visual acuity chart is being shown to a patient. Assessment of any eye power, spectacle power with help of refraction. Visual field test for amount of visual field. The doctor would examine on a special machine called as a slit lamp, where a microscopic evaluation of the front part of the eye is done. Or with the help of dilated evaluation, a retinal exam is done for the back portion of the eye, along with screening for glaucoma. So, when would I recommend eye tests for any person? For children, I would say between 3 to 5 years before they start their school, I would recommend an eye test. For children who are born premature, I would an eye test slightly earlier, around 1 year or 2 years of age. If there are no family history of any eye disorders, no one wears glasses, and there is no symptoms in a person, repeat checkup every 2 years or 1 or 2 years is very good. When would I recommend eye checkup in adults? In the early 20s, I think I would check up a normal person every 5 years. In between the age of 40 to 50s, I think every 2 to 4 years is a good enough schedule for eye checkup. After 50s, regular checkup, 1 to 2 years is very recommended. And after the age of 65, again, every 1 to 2 years is also a very good way to identify age-related eye disorders. So this brings me to the end of my brief presentation, and I would like to share with you that it's uh, it's about how we look at ourselves and the world with our eyes. So I would like you to take a pledge, and I take a pledge today to donate my eyes and light up a life after I am dead. And this not only helps visually impaired to see the beauty of life, but allows me to see life after my death as well. And this holds true even for other organs. And I take a sincere this opportunity for uh, asking everyone for organ donation so that we live our lives through others even after our death. Thank you all for your patient listening. And I would like to really ensure that if you have any questions, I have shared my mobile number 810-4646-887. Um, this is a WhatsApp number of our hospital wherein you can connect with us. And if you have any queries, please share with them with us, and we'll be happy to solve your queries. Thank you so much for your patient listening, and goodbye.